is Audrey Bilello, and I'm a third-year physical therapy student at Upstate Medical University. Today I'll be presenting my project for my in-service. My presentation focuses on medical Spanish in the inpatient rehabilitation setting, highlighting its relevance for patient care and providing a practical reference guide for students, clinicians, and other team members working in inpatient rehabilitation facilities. Why did I choose this topic? Throughout my prior clinical experiences, and especially during my first week on this unit, I've had the opportunity to work with Spanish-speaking patients. Physical therapists often interact with Spanish-speaking patients across a variety of care settings. While interpreter services are essential and should always be used appropriately, I've noticed that lacking a basic familiarity with medical Spanish can sometimes disrupt the natural flow of treatment. It can make it more challenging to build rapport, provide simple movement cues, or quickly clarify instructions during activities. This in-service reflects my belief that foundational medical Spanish use alongside interpreter services can promote safer and more efficient patient care, improve patient understanding, and strengthen therapeutic relationship in inpatient rehabilitation. I believe that even small language skills can make a meaningful difference in patient outcomes and overall patient experience. My goals for this presentation are to explore the research on the benefits of medical Spanish for patient communication and clinical outcomes, as well as introduce a practical reference guide of basic medical Spanish phrases for introductions, courtesies, and directional or positional cues for optional reference. I would like to begin by emphasizing that this project is not meant to replace qualified interpreters. It is important to note that therapists are not being asked to take on that role. Both the presentation and the reference guide are supplemental tools and do not replace the services of a qualified interpreter, which are required under the ADA, ACA, hospital policies, and union agreements. Interpreters do much more than just translate words. They also provide the cultural context, which a quick reference guide cannot cover. The goal of this project is simply to give the therapist a shorthand reference guide they can look at if so interested. It is not meant to be memorized or used independently of an interpreter. In short, this is a tool for reference, not a substitute for professional interpretation in patient care. What does the research tell us about medical Spanish in physical therapy? Many studies show that Spanish proficiency is essential for effective clinical communication. While there are numerous studies on this topic, I've selected 4 that I found most relevant to my project, particularly in terms of improving communication and patient care in clinical practice. Here are the key clinical takeaways from each article. The first study concluded that language concordance is associated with higher patient satisfaction and engagement. The second study found that clinicians with Spanish proficiency reported improved communication and stronger rapport. The third study found that language barriers can reduce perceived quality of care and limit treatment effectiveness. And finally, the last article found that in inpatient rehabilitation, basic medical Spanish serves as a critical complement to interpreter services. I will now be taking a deeper look into each of these studies. Here is the first study that was published in 2021. The purpose was to determine whether direct Spanish communication improves patient satisfaction compared to using professional interpreter services. For the methods, there was 83 Spanish-speaking patients with limited English proficiency that were randomized to receive care either directly in Spanish from bilingual providers or through interpreter services. The key results were that patients receiving care directly in Spanish reported significantly higher satisfaction with communication, empathy, time spent, and overall care. For the conclusions, they found that even basic language skills may enhance rapport and communication when used appropriately. They found that direct language concordance improves patient satisfaction beyond interpreter use alone. Patients were more engaged, asked more questions, and showed more concerns. Here is the second study published in 2023. The goals of this research was to examine how Spanish language proficiency of providers affects communication quality and satisfaction in Spanish-speaking patients. Another goal was to explore the role of language concordance in patient-provider interactions when no interpreter is present. This was an exploratory study of 128 Spanish-speaking primary care patients and their physicians. Medical visits were audio recorded and rated by 5 independent reviewers for provider Spanish proficiency and communication behaviors. Following these interactions, both patients and physicians completed visit satisfaction questionnaires. The results of this study found that physicians with stronger Spanish skills reported less frustration and felt more connected to their patients. Patients whose physicians spoke more Spanish reported greater choice and involvement in care and higher satisfaction with the information provided. The results showed that greater Spanish proficiency was associated with improved patient satisfaction, though some physicians still perceived challenges in fully understanding patient concerns. So for the final conclusions, this study found that language concordance improves patient satisfaction and patient-provider connection. Provider Spanish proficiency positively influences communication quality even without interpreter use. And these findings support the importance of developing language skills to reduce communication barriers and enhance patient-centered care. Here is the third study that was published in 2024. The purpose was to examine how language barriers affect physical therapists' perceived quality of care, and to identify gaps in multilingual outcome measures, communication, and interpretive services in PT practice. This was a systematic review of English language peer-reviewed articles across 3 databases. Included studies examined language barriers, communication, outcome measures, and interpretive services in rehabilitation settings. Their results found that language barriers limited collection of patient history, goals, and subjective data, that a lack of validated non-English outcome measures reduced reliability of assessments, that reduced collaboration led to more therapist-driven goals and generalized interventions, and that limited or inconsistent interpreter use negatively impacted rapport and perceived care quality. It is important to recognize a few limitations of this study. First, there is limited research that is specific to physical therapy. Some of the studies included multiple rehabilitation disciplines, not just physical therapists. Many of the studies also had small sample sizes and used different methods, which could affect how consistent the results are. And finally, most of the outcomes were based on therapist perception rather than patient-reported outcome or objective measures. Despite these limitations, this study concluded that language barriers can negatively impact the quality of physical therapy care. Limited multilingual resources make it harder to provide truly individualized and patient-centered treatment. Inconsistent use of interpreters also contributes to poor communication and potentially worse outcomes. Overall, there is a clear need for standardized guidelines and better multilingual tools to support best practice in physical therapy. Here is the final study that I included that was published in 2022. The goals of this research were to explore how language barriers affect the delivery of rehab services for patients with limited English proficiency. Because rehabilitation requires movement cueing and real-time feedback, interpretation in PT and OT settings presents unique challenges compared to other medical environments. This study examined experiences of both the rehabilitation clinicians as well as the Spanish-speaking patients. This was a qualitative study using 4 focus groups. Participants included 13 occupational and physical therapy clinicians and 7 Spanish-speaking patients. Transcripts and field notes were analyzed using directed content analysis. So, the results showed that clinicians' interpreter use was heavily influenced by things like time constraints, available resources, session demands, the environment, and even patient characteristics. Patients reported very limited access to professional interpreters and often described clinicians as trying to get by with minimal Spanish or nonverbal communications. Clinicians themselves described both challenges and rewards when working across language barriers. For the conclusions of this study, they found that language access in rehabilitation is different from other medical settings and required rehab-specific solutions. They found that interpreter use is inconsistent and often driven more by logistical barriers than patient-centered needs. This highlights the need for more clear practice guidelines, better systems, and stronger resources to properly support language access in rehabilitation care. So after reviewing the research supporting basic medical Spanish proficiency, I began developing my own reference guide focused on medical Spanish commonly used in inpatient rehabilitation. The goal is to create something practical, accessible, and directly applicable to real patient interactions in the rehab setting. To begin, here's the cover page for my reference guide. Here is what my 4-page reference guide looks like. I'm going to go through each section and explain what's included so you can see how it's organized. The first section of this reference guide goes over basic conversation, common phrases, orientation questions, and consent and readiness questions. Starting with basic conversation, this section includes things such as greetings and introductions, stating your occupation, asking about emotions, and other formalities that may come up when you first meet a patient. One really important thing to remember in Spanish is that nouns are gendered. So el is masculine and la is feminine. For example, if I was a female nurse, I would be la enferma, and a male nurse would be el enfermo. Next, common phrases. These are statements, questions, and responses you'll hear or use a lot, both in general conversation and in physical therapy. This includes things like asking about their needs and mobility, knowing how to say yes/no responses, and other common statements that you may need to use. Then we have orientation questions. These help you gather basic information about the patient's cognition. They're useful to help orient the patient to know where they are, the date, or what's going on during this section. Finally, there are consent and readiness questions. These make sure that the patient is informed and comfortable with what's happening. You might ask if they need a break, explain what you're doing, or check that they understand and are okay with participating in the activities. So overall, this first section is really about setting up good communication with your patient and making sure they feel safe, informed, and ready to participate. For the next section, we will go over some more specific medical information that comes up during patient interactions. First, we have the parts of the body. This is a more general overview of different regions of the body so that we don't get overwhelmed with a long list of every specific body part. It gives you a practical way to reference areas quickly. Next is the vitals and exams section. It is important to note that examinations should not be completed without an interpreter present if needed, since this is key medical information and we want to make sure that nothing is misinterpreted. This section provides common phrases you might use when taking vitals or performing an exam, like asking about blood pressure, heart rate, or temperature. It also includes phrases for asking if the patient is taking medications and when they last took them. After that, we have pain. This section is included because many patients may be experiencing pain, and it is important that they can communicate it clearly. The guide shows how to combine a body part with phrases for pain. For example, if a patient wants to say, "My head hurts," you could use the body part section and say, "Me duele la cabeza." Finally, there is a section on common symptoms. These are things patients often report that are helpful for us to know. These help us understand what they're experiencing and allows us to ask about any symptoms they may have during the session. This section represents the foundation of my reference guide project. It focuses on the types of cues we use every day as physical therapists. The categories included are simple cues for movement, timing and pace, positional and postural changes, directions, movement quality, repetition and sequencing, encouragement and reassurance, and safety and fall prevention cues. As physical therapists, much of what we do relies on verbal feedback and cueing. We are constantly guiding movement, correcting quality, adjusting timing, and ensuring safety, which is why I felt it was so important to include this section in my reference guide. For the movement cues section, I included a simple movement command structure. The format is verb plus to or tus, and then following with the body part. To is used in cases of singular nouns, and tus is for plural nouns. Examples include levanta tu brazo, or lift your arm, or relaja tu hombros, or relax your shoulders. When adding an adjective, the structure becomes verb, then tu or tus, followed with the body part, and then finally the adjective. So to say lift your right arm, you would say levanta tu brazos derecho. And to say extend your arm straight, you would say extiende tus brazos rectos. This structure keeps commands clear and easy to reproduce during treatment. The next section includes simple cues. Similar to the body part section, I selected generalized and commonly used cues that apply across many patient populations. These are broken down into movement cues, timing and pace cues, and position and posture cues. This organization helps match the cue to the movement task being performed. The directions section focuses on spatial awareness, knowing where to move in space, knowing where a target may be, knowing where to walk, and knowing how to orient the body. The movement quality and repetition section includes words that describe how a movement should be performed. For example, controlling the motion, adjusting the range, slowing down, or repeating a sequence. Encouragement and reassurance are also included because patient motivation and trust are critical. Providing positive feedback and reinforcing that the patient is safe and doing well helps build rapport and supports engagement in treatment. Finally, safety and fall prevention cues are essential. Patient safety is always the top priority, so having quick, clear cues such as slow down, stop, or reminders about weight-bearing precautions ensures that we maintain safe mobility when working with our patients. Overall, this section was designed to reflect real clinical communication, the practical movement-to-movement cueing that happens during our treatment sessions. This section is more of a reference for simple information like dates, times, colors, and numbers. You could use it to give sets, repetitions, durations, or other quantities. For example, if something is happening today, tomorrow, or yesterday, you could say hoy, mañana, or ayer. You could also talk about other time-related phrases like days of the weeks or specific times of the day, which can help patients understand schedules or timing for exercises. Using this with the numbers section, if you wanted to say that something was 2 weeks away, you could say 2 semanas, or if you wanted the patient to do an activity for 30 seconds, you could say 30 segundos. I also included colors which may be helpful for visual cues. For instance, if you're doing a stepping activity and want to cue the patient to step to a specific target, you could use the colors in order to guide them. The final section covers questions for patient care in the room, assistive devices and equipment, items in the room, and nutrition such as foods and drinks. This section is especially useful in inpatient rehabilitation where patients live at the facility. In these facilities, physical therapists often retrieve patients from their room or complete the session in the patient's room. For the first section, these are common questions you may ask in the patient's room, such as questions about the call bell, whether they want the lights on or off, the door opened or closed, or if they need to use the bathroom. These small questions help make the patient comfortable and ensure that their needs are met while they are in their room. Next, assistive devices and equipment. This is very important for PTs to know which devices the patient uses for mobility or other purposes. Understanding what equipment the patient has allows us to clearly communicate about safety and proper use and also helps us guide the therapy session. Then, items in the room. This covers furniture or other objects you might refer to during therapy, whether for giving directions or just talking about the environment. Finally, I included a nutrition section. Some patients may be on modified diets, or you may need to be able to ask about meals, drinks, or food preferences. These are common phrases that can help facilitate conversations about nutrition, ensuring that the patients get the support and guidance they need. So that concludes my reference guide. The reference guide I designed as a shorthand, quick access cueing tool, something I personally would have found very helpful during my clinical experience in an inpatient rehab setting. The goal was not to replace formal language learning, but rather to provide a practical, day-to-day patient care and movement-based communication guide. Beyond my guide, there are numerous well-established resources available for learning medical Spanish more comprehensively. For those who are interested in expanding their skills or who may work in a different clinical setting with additional vocabulary needs, I've included several reputable options here. These include dictionaries and quick references, books and independent study resources, online learning platforms, and translation and clinical communication apps. I would also strongly encourage reaching out to your institution's interpreter services or employer to learn about additional language support tools available at your clinical setting. Many hospitals and rehabilitation facilities provide resources that clinicians may not be aware of. Overall, this slide emphasizes that this reference guide is a starting point, a practical clinical tool, but there are many ways to continue developing proficiency in medical Spanish depending on your interests and the patient population that you may work with in the future. So that concludes my presentation on the relevance of medical Spanish in inpatient rehabilitation and the development of my reference guide. I hope this was helpful and highlighted the importance of improving communication to better support our patients. Thank you all so much for your time and for listening.